Hi and welcome to Heal My Hemorrhoids. In this video you will learn how long hemorrhoids can last. So watch the whole video to the end to get all of the tips you need to make sure you can get rid of them fast or how to prevent from getting hemorrhoids. Remember to hit the subscribe and like button if you like this video. The most common answer to how long do hemorrhoids last is that they last for about 4 to 5 days. If you act in an early stage of their development you might get away with only a couple of days. If you ignore them it can take up to a couple of months to clear them. In the worst cases, they can bother you in years. A hemorrhoid is a clump of a dilated blood vessel that is in the lower rectum and anus. There are various things associated with their development. How long do hemorrhoids last? This is a question most individuals tend to ask when suffering from this condition. However, there are several factors that will affect the duration in which hemorrhoids will last before it is cured. At times, hemorrhoids swell as a result of the veins enlarging, and their walls become stretched, thin, and irritated by a bowel movement. Despite hemorrhoids being painful, they are not life-threatening. However, treating them will be the best in order to get rid of the pain associated with them. In this article, we shall be focusing on how long do hemorrhoids last before they are fully healed. The time in which a hemorrhoid takes before it heals is profoundly affected by several aspects, including the type of hemorrhoids you are suffering from. There are two types of hemorrhoids, internal hemorrhoids and external hemorrhoids. The time in which these two types of hemorrhoids take to heal differs significantly. Internal hemorrhoids are located inside the rectum lining, and they are not that obvious unless they are enlarged substantially. In this case, you can feel them. Unlike external hemorrhoids, internal hemorrhoids are painless, and they become apparent due to the bleeding they cause during a bowel movement. Sometimes, this type of hemorrhoid protrudes or prolapses outside your anus. In such cases, you will be able to feel or see them since most parts of the skin will be pinker than the surrounding area. The fallen hemorrhoids might be painful since the anus features numerous pain-sensing nerves. These fallen hemorrhoids usually recede by themselves. However, if they fail to subside on their own, they can be put back gently into their original place. Internal hemorrhoids are said to go away after several months when proper treatment is put in place. On the other hand, external hemorrhoids are located under the skin surrounding the anus area and often lower when compared to internal hemorrhoids. External hemorrhoids can be felt as they swell and they often cause pain, itching, bleeding during bowel movement. When an external hemorrhoid protrudes outside, which usually occurs when during a bowel movement, you will be able to see and feel it. Blood clots often occur within this type of hemorrhoids, resulting in a painful condition known as thrombosis. Whenever hemorrhoid becomes thrombosed, it will appear frightening since it will turn purple or blue, and it can bleed easily. Thrombosed hemorrhoids are not that serious despite having a scary appearance. However, they possess severe pain. These types of hemorrhoids usually resolve by themselves after a couple of weeks. If the pain persists, a doctor will help you get rid of the blood clot in the thrombosed hemorrhoid in order to ease the pain. External hemorrhoids are extremely painful when compared to internal hemorrhoids. Apart from the type of hemorrhoids you are suffering from, hemorrhoid severity profoundly affects the duration in which hemorrhoid lasts. How long do hemorrhoids last can be determined by how severe or mild the hemorrhoid is. Often physicians categorize hemorrhoids in 4 stages using a grading system. First-degree hemorrhoid. These are hemorrhoids that protrude and retract by themselves with or without the presence of bleeding. These might come out via the anus during certain activities such as passing stool, and they return to their original place. Second-degree hemorrhoids. Grade 2 hemorrhoids are vein swellings that protrude past the anal verge with bowel movement or passage of the flatus. Third-degree hemorrhoids. These hemorrhoids prolapse and they have to be pushed back to their original position using a finger. Fourth-degree hemorrhoids. These hemorrhoids prolapse and cannot be pushed back into their original place. These hemorrhoids have some hemorrhoids that are thrombosed or the ones that pull much of the rectum lining through the anus. How long do hemorrhoids last? This is a question that can be determined by the 3 stages of hemorrhoid severity. For most individuals, hemorrhoids last for an extended period. Consistent pain is often common among individuals above the age of 50 years. The pain associated with hemorrhoids often returns among most individuals after several years of treatment, whereas it becomes recurring for most people as it becomes more common as time goes. However, smaller hemorrhoids tend to go away within a few days. During this time, it is best to avoid irritating the rectal area by keeping the rectal area as clean as possible. Your body's response to the condition will be determined by how long do hemorrhoids last. Time taken to heal hemorrhoids tend to differ from one individual to the other. Furthermore, hemorrhoids will not disappear entirely if not properly treated. Some individuals will feel better after a few weeks, whereas others will continue feeling the pain until the hemorrhoid is removed surgically. Lifestyle plays a significant role in answering the question, how long do hemorrhoids last? Some lifestyle behaviors are responsible for worsening your hemorrhoid condition. Some of the behavioral changes you might need to adapt in order to make condition better include: avoid delaying bowel movement whenever a need arises. Take frequent showers. Take warm sit to help in relieving the symptoms. Frequent physical exercise to aid in improving bowel movement. Washing your anus gently after every bowel movement. Use a small stool to prop up your legs during a bowel movement. Furthermore, changing your diet will significantly aid in reducing toilet time. It is best as well to avoid bringing a smartphone, book, or newspaper with you to the restroom. Usually, there is no set duration for hemorrhoids. However, small hemorrhoids often clear up within a few days without using any mode of treatment. On the other side, large external hemorrhoids usually take an extended period before healing, and they are often associated with severe pain and discomfort. If you are suffering from hemorrhoids and they fail to clear up within a few days, it will be best for you to see a doctor. Some of the risk factors associated with recurrent or severe hemorrhoid include chronic constipation, obesity and overweight, reduced fiber consumption, pregnancy, aging muscle, chronic diarrhea, anal sex intercourse, straining during bowel movement, sitting on the toilet for an extended period, abusing, overusing laxatives or enemas. Furthermore, these factors are responsible for the time taken for hemorrhoids to heal. Understanding hemorrhoids better will help you figure out how long do hemorrhoids last as well as factors that lead to their development. Usually, hemorrhoids come from tiny groups of veins that are located near the mucosal membrane of the lower rectum and anus. When the veins are irritated or swollen, they often occur. Whenever a hemorrhoid becomes enlarges and stick out of the anus, it becomes prolapsed hemorrhoid. These types of hemorrhoids often take an extended period before healing, and they often require a doctor's treatment. During pregnancy, women tend to develop hemorrhoids due to the increase in pressure in the abdomen. This is often common during the third trimester. It often results in enlarging the vein present in the anus and rectum. The hormones present during pregnancy often worsen the situation by expanding the size of the veins. Hemorrhoids during pregnancy tend to heal a few months after delivery. Dietary. When it comes to hemorrhoids, diet plays a significant role. Furthermore, with diet, you will be able to understand even better how long do hemorrhoids last. Here are some essential dietary tips you will need to put in mind when suffering from hemorrhoids. Fiber. How long do hemorrhoids last can be determined by the amount of fiber you consume on a regular basis. Usually, individuals with infrequent bowel movements have a high chance of developing hemorrhoids. In order to improve your bowel movement, it will be best to increase your fiber consumption via supplements or your regular diet. Doctors and gastroenterologists recommend you add fiber to your diet. An increase in fiber content will increase gas buildup. However, it is one of the best methods of managing and preventing the development of hemorrhoids. Food that is rich in fiber includes legumes such as lentils, lima beans, and black beans, among others, whole grains such as bran flakes, brown rice, and oatmeal, among others. Furthermore, some vegetables and fruits such as green peas, Brussels sprouts, broccoli, apples, pears, bananas, and raspberries have a high content of fiber. Water. Water is essential, especially when determining how long do hemorrhoids last. Water plays a vital role in enhancing bowel movement, making it one of the best hemorrhoid management and prevention strategies that are relatively easy to adhere to. Along with the consumption of a high-fiber diet, frequent hydration from water is essential when it comes to bowel movement. Usually, drinking an ample amount of water aids in constipation prevention. Hemorrhoids are associated with constipation. Having 6 to 8 glasses of water every day will help your digestive system operate smoothly and have a positive benefit to your general health. Laxatives. During constipation, some fiber supplements such as psyllium capsules will help you heal significantly, hence aids in preventing hemorrhoids development. Laxatives are ideal when it comes to managing constipation as long as you are using the right one. Usually, the best laxative you can use is the one that works well with your body rather than stimulates normal physiological activities such as stimulation of the intestinal contraction in order to move contents along. These laxatives can lead to an increase in hemorrhoid pressure, worsening the severity of the condition. It is best you be careful when using laxatives in managing constipation and hemorrhoids. Exercise. Exercise will significantly affect how long do hemorrhoids last. This is because they feature a love-hate relationship. When you exercise frequently, your colon becomes more regular. However, when you engage in physical activities that will increase your abdominal pressure or straining, such as weightlifting, can result in the development of hemorrhoids. Staying active reduces the time you spend sitting and putting pressure on your lower rectum vein. If you are an individual with a problematic history of hemorrhoids, it will be best for you to stay away from weightlifting as well as other activities that are strenuous. Some moderate activities such as yoga, walking, or swimming frequently will aid in preventing hemorrhoids from recurring. Common signs associated with hemorrhoids. As previously mentioned, hemorrhoids are often painful, but at times they don't possess any pain, especially for internal hemorrhoids. This is why it is best to check out for the following signs in order to determine whether you have hemorrhoids or not. An external lump to your anus area. Swelling within the areas adjacent to your anus. Itching even after thoroughly cleaning your anus. Burning sensation during a bowel movement or at rest. Pain and discomfort. Hemorrhoid diagnosis. Diagnosis will determine how long do hemorrhoids last. When you carry out early diagnosis, you will be able to treat and manage the condition before it progresses. Some of the common diagnosis processes include colonoscopy, anoscopy, blood presence in the stool. Usually, common risk factors for hemorrhoids relate to the increase in pressure on your rectal as well as an anal vein. Furthermore, a family history of hemorrhoids increases your susceptibility to hemorrhoid development. If you experience severe pain due to hemorrhoids, it will be best to seek medical attention to help in managing the condition and prevent the development of any further complications such as strangulated hemorrhoids, blood clots, and anemia. As we come to a conclusion, we hope that you have understood how long do hemorrhoids last and how you can prevent their development. Thanks for watching. Don't forget to hit the like button and subscribe for more videos. I hope the video was helpful for you. For more articles and videos, go to healmyhemorrhoids.com.